I think we're at exciting times that taking the connectum together with AI will give us the power to improve diagnostics, to predict outcome, and to personalize medicine. My name is Dr. Abigail Livny Ezer. I'm the head of the Diagnostic Neuroimaging Laboratory at Shiva Medical Center. I'm a neuroscientist and a neuroimaging expert. My research focuses on neuropathologies and how the brain reorganizes due to acute or chronic brain pathologies. So like every person has their facial characteristics and their unique genetics or fingerprints, so does every person has their unique neural prints. And this neural print is the connectum, which is the map of brain connections. To create a connectum, we can use the MRI to scan both structure and function scans. And from each one of these scans, we can create a personalized connectum. One structural connectum and the other will be the functional connectum. If there's a neuropathology, then the brain reorganizes. And we try to investigate how this reorganization corresponds to a clinical outcome, to cognitive outcome. From these sequences, we can use image processing and AI or algorithms in order to quantify different aspects of the brain. So the AI enables us to see things that will be very difficult to see with your naked eye. If you look at the connectum, it's a vast amount of connections that we can't all see in our eyes. So if there is a pattern that is changed, we won't be able to see them. But if we add all these connectums into a model of AI, and we will learn the pattern of a specific disease above and beyond the personalized structure of the brain, then we will understand the mechanism of the brain disorder. For a structural scan, we will scan a DTI scan, which follows the water molecules in the brain. And then it creates a map of the diffusion of the water molecules in the brain. I will follow the tracks of the brain, and I will create a map of the connections from one region of the brain to the other region of the brain. That will be the structural connectum. If I want to create a functional connectum, I will scan an FMRI scan, which follows the blood flow of the brain when there's an indirect measure of neural activation. So the brain is doing a function, it's activated, then the neurons consumption oxygen from the blood, so there's an increase in the blood flow. It's almost like hardware and software. The hardware will be the structural connectum and the software will be the functional connectum. And it's very interested in different pathologies, because if you will look at traumatic brain injury, for instance, or a concussion, then you will have structural disconnections, but the functional are supposed to be intact. The basic point is trying to understand the mechanism behind each of these brain disorders. The connectors will be able to serve as biomarkers for certain disorders. I think the brain is an amazing organ, and there's so much more to learn about it. We're only in the beginning.